My name is Scully, and a group of kids prepared a little show and tell about the anatomy of my body. Well, Bones! In case you are wondering who are these kids I'm referring to, here they are. It's Avayo, the one who edits the video, Lisa Kanya and Mpake, who will tell you more about my head, well, Skull, Refilwe and Seema, who tell you all my regional vertebrae. Well, to make it easier, my spine here. Now, they didn't want to show themselves because they feel like they would be taking my spotlight. Well, they are correct, this all about me. Let's begin with my skull, which will be presented by Lisa. And Mpeke, I don't know why she took my head off.
This presentation covers the lateral view of the skull, identifying major bones, their key landmarks, facial bones with their functions and relevant sutures. Here's an overview of the locations of the facial bones mentioned. Number 1, we have the sphenoid, which is located in the skull's base. It contributes to the size of the cranial cavity. Number 2, the mandible, which is the lower part of the face and forms the lower jaw. Number 3, the vomer. It is located within the midline of the face, inferior part of the nasal cavity, and it also forms part of the nasal septum. Number 4, the nasal bones. It is the upper part of the nose that forms the bridge. The maxilla is the central part of the face that forms the upper jaw, and the lacrimal bones are located within the medial wall of the orbit near the nasal cavity. The zygomatic bones are the sides of the face which form the cheekbones. These facial bones contribute to the structure of the face. It supports sensory organs and facilitate functions like eating and breathing.
Okay, I'll be talking about the reciprocity of structure and functions in the bones of the skull. Firstly, we have the frontal bone. The frontal bone's curved shape provides protection to the brain's frontal lobe. It also contains sinus cavities that help reduce the skull's weight and produce mucus to filter out the air we breathe. And then we have the parietal bone. The parietal bone's flat curved shape provides protection for the brain's parietal lobe. It also helps stabilize the skull and provide attachment points for the muscles. And then we have the occipital bone. The occipital bone's curved shape provides protection for the brain's occipital lobe. It also forms the base of the skull and provides attachment points for muscles and ligaments. And then we have the temporal bone. The temporal bone contains the structures responsible for hearing and breathing, including the cochlea, vestibular, and semicircular canals.
And now we go on to the glues of my bones, aka the sutures.
We have the sagittal suture, which is a type of fibrous joint that connects two parietal bones of the skull, and it allows flexibility and movement between the parietal bones, accommodating changes in cranial pressure and growth. Lambdoid suture. The lambdoid suture has a lambda shape with a curved or angled profile that allows for flexibility and movement between the parietal and occipital bones. And squamosal suture has a scaly or overlapping shape with adjacent bones overlapping each other to provide stability and resist shear forces.
Okay, now, that's it for my head. Now it's time for my back. And by that, I mean the spine. Now, I'll let Refilwe and Seema do all the talking.
Greetings. So today I'll be explaining the regional vertebrae. The regional vertebrae is the spinal cord. So our spinal cord consists of 4 types of spines: the cervical spine, the thoracic spine, the lumbar spine, and lastly the coccyx and sacrum. So the first one, which is the cervical spine, it's from T1 up to T5. From here upwards is the cervical spine. So its function protects the spinal cord, supports the neck and its movement, while it facilitates blood flow to the brain. Secondly, we have the thoracic spine, which is from T1 up to T12. It also protects the spinal cord. It supports the neck. It anchors the rib cage. Thirdly, we have the lumbar spine, which is from here to the lumbar spine. It contains of 5 pairs. So the function of the lumbar spine, it allows truncal movements and it controls leg movements. Yes. Lastly, we have the sacrum and the crucix, which is the little bit of the little tail. This one. It protects the quadra equina. It forms the back wall of the pelvis and the hip. It facilitates walking, running, and sitting and jumping, and it contains a set of nerve roots which innervate the lower part of the body. Yeah.
The body of the cervical vertebra is small, wide side to side, and the spinous process is short, bifid, and projects directly posteriorly. And the vertebral foramen is triangular, and transverse process contains foramina. As for the articulating processes, the superior facets are directed posteriorly, and the inferior facets are directed inferior anteriorly. The movements allowed are flexion and extension, lateral flexion and rotation. It is a spine region with the greatest range of movement. Moving on to the thoracic vertebra. It is larger than the cervical. It is heart-shaped and bears 2 costal facets. The spinous process is long, sharp, and projects inferiorly, and the vertebral foramen is circular, and the transverse process bears facets for ribs, except T11 and T12. The articulating processes, the superior facets are directed posteriorly, and the inferior facets are directed anteriorly. The movements allowed are rotation, lateral flexion, possibly but limited by ribs, and flexion and extensions are prevented. Moving on to the lumbar. The lumbar is massive and kidney-shaped. That's the body. And the spinous process is short, blunt, and projects directly posteriorly, and the vertebral foramen is triangular, and the transverse process is thin and tapered. The superior and inferior articulating processes, the superior facets are directly posterior medially or medially, and the inferior facets are directed anterolaterally or laterally. The movements that are allowed are flexion and extension, and some lateral flexion and rotation is prevented.
Okay then, mates. That was all they had in them. Hope you didn't get bored too much, but gained more knowledge about my body. Okay, and that it's it. Goodbye.